Hello, Brad here from 999 KnowHow. In this video, I'll be going through the normal physiological parameters for infants and children. We'll also take a close look at the POPS score, an essential tool for assessing the clinical status of pediatric patients. POPS score helps us detect early signs of deterioration in children, guiding appropriate responses to ensure timely and effective care. Throughout this video, I'll be referencing guidelines from JLCalc, NICE and NHS England. You can find links to these resources and the POPS score in the video description. If you or a child is unwell, always seek professional medical assistance. In the UK, you can call NHS 111 for the right advice and treatment when you urgently need it. With that covered, let's get started. As first responders, understanding the normal physiological parameters for paediatric patients is crucial, as these can vary significantly from those of adults and differ based on a child's age. Paediatric Observation Priority System, POPS, is a clinical tool designed by Dr. Rowland and Dr. Davis to identify early signs of deterioration in children. It systematically monitors key vital signs, scoring them accordingly to age-specific thresholds. POPS monitors vital signs such as oxygen saturations, signs of respiratory distress, consciousness level, gut feeling, previous medical history, heart rate, respiratory rate, and temperature. Each of these parameters is scored based on how far the child's measurements deviate from the normal range. For example, a normal respiratory rate will score 0, while an elevated or severely abnormal rate will score higher, indicating the level of risk. It's important to note that blood pressure does not contribute to the POPS score, though it remains a critical parameter in paediatric assessment. Here are the normal blood pressure ranges for various age groups. While these values are useful for broader medical assessment, they do not affect the POPS score. The individual scores from the key parameters are added together to create a total POPS score, which helps guide clinical decisions. Higher scores indicate need for more urgent intervention. Remember, the score is a guide and should never replace clinical judgment. Now let's imagine you're called to assess a 7-year-old boy named Jamie, who has been unwell for 4 days with a high temperature. His mother is concerned about his breathing. You utilise the POPS system to evaluate his condition. As always, every patient interaction starts with a quick primary survey to identify any immediate threats to life. I'll cover the primary survey and assessment methods in more detail in up-and-coming videos. Primary survey complete, so let's incorporate the POPS score tool into Jamie's assessment. We'll apply the 8 parameters to gauge his overall risk. His oxygen saturations are 92%, scoring a 1. He has an audible wheeze, scoring another 1. He is alert, which scores 0. However, you have a high concern for gut feeling, which scores 2. He has no previous medical history, scoring 0. His heart rate is 135 beats per minute, which scores a 1. His respiratory rate is 30 breaths a minute, scoring another 1. And his temperature is recorded as 38.5 degrees. This also scores 1. With a total score of 7, Jamie is at high risk of deterioration. Based on this, you should escalate care immediately, possibly calling for advanced support or providing rapid transport to hospital. Let's break down a few key terms commonly used in paediatric care. Hypothermia, which is low body temperature. Hyperthermia, which is high body temperature. Tachycardia, which is a fast heart rate. Bradycardia, which is a slow heart rate. SpO2 or SATs, which are the oxygen saturations in the blood. Respiration rate, which are the breaths taken per minute. bradypnea, which is slow breathing rate, and tachypnea, which is a fast breathing rate. Let's quickly recap the key points covered in this video. Pediatric patients have different normal ranges for vitals based on age. The POP score is essential for quickly assessing a child's risk of deterioration. Remember, the score is a guide and it doesn't replace clinical judgment. JLCalc is an invaluable resource for specific normal parameters based on age. Thanks for watching. I hope this video has helped you better understand paediatric vital signs and the POP system. If you've enjoyed this content, please like, subscribe and follow us to support the channel. If you're feeling generous, you can also use the link in the description to buy me a coffee. Have any topic suggestions for more videos? Drop them in the comments below.